Hi friends, it's Dr. Alice. I hope that you are well. Today I wanted to talk to you to fill you in on a condition called Multisystem Inflammatory Syndrome in children, or MISE for short. So what is it? Basically, it's a new face of COVID-19. It adds a new dimension to how we think about this illness, especially in children and adolescents. Because up until now, COVID-19 has largely been a mild or at most moderately severe illness in the vast majority of children. Whereas in contrast, MISC is a very serious illness condition, and in some cases it has led to fatalities. So different agencies and countries have varying case definitions for MISC, but the common points are a high fever of at least 24 hours duration, signs of inflammation on blood tests, evidence of clinically severe illness leading to hospitalization and at least 2 organ systems that are involved. There needs to be no other identifiable cause of illness, such as bacterial sepsis or other causes of shock. And there needs to be proof either of current or past infection with COVID-19 or a history of exposure to COVID-19 over the last 4 weeks. What are the symptoms? So fever is a universally present symptom and is required for the diagnosis of this syndrome. The other symptoms are variable, and they can include lethargy or low energy or a feeling of fatigue. Also, there can be bloodshot eyes, a change in the oral mucosa or the lining of the mouth, a rash, especially on the hands and feet, sore throat, cough, and a very prominent symptom. Most children and adolescents have actually complained about abdominal symptoms. So abdominal pain, nausea, vomiting, and diarrhea. And of course, this is different from how COVID-19 typically manifests initially in adults. Other features of MISC are shock. In other words, very low or dangerously low blood pressure, either because the heart is not pumping properly or because there is damage to the blood vessels that causes dilatation of the blood vessels, leading to very low blood pressure. On blood tests, there are very high levels of inflammation and evidence of damage to the heart muscles, to the kidneys, or the liver. The inflammation can affect not just the muscles of the heart, but also the blood vessels of the heart, the coronary arteries. And this can lead to dilatation of the coronary arteries and also aneurysms. And aneurysms are small outpouchings of the blood vessels. And these are dangerous because they are prone to rupture. Treatment has included standard critical care in an ICU setting, including supplemental oxygen and the use of medications and machines to support the blood pressure and support the function of the heart, lungs, and kidneys. Medications have also been used to target specifically the inflammation and the immune response, including IVIG, steroids, and aspirin. The good news about MISC is that the vast majority of children and adolescents who have been diagnosed and managed appropriately have survived. And so it is not a uniformly fatal disease, even though it is new and it is scary. We should know that the majority of children have recovered, including the 2 suspected cases of MISC here in Korea. Now, we don't know which children who get COVID-19 will later develop MISC. So we don't know the risk factors for MISC. We also don't know exactly what is going on in the body to cause this condition, but we do have some hypotheses. And one hypothesis is that the infection with COVID-19 is triggering a massive immune response against the virus. And this immune response then backfires to cause damage to our own body and our own body's organ systems. Now, I have two take-home messages for you. First, so far, as I mentioned, multisystem inflammatory syndrome in children, although it is a very, very serious condition, has largely been treatable. The second take-home point is that parents, teachers, doctors, and even children need to be aware of this condition. So if a child who has had COVID-19 or has had exposure to COVID-19 suddenly develops a high fever, and then any of the other symptoms that I mentioned, and I'll tell you what they are again so that you remember. So it's fatigue, lethargy, low energy, a rash, especially on the hands and feet, bloodshot eyes that kind of look like pink eye, change in the oral mucosa or the lining of the mouth, sore throat, cough, and remember those prominent abdominal symptoms. So if they complain of a tummy ache or they have nausea, vomiting, or diarrhea, then this child who has these symptoms needs to be evaluated quickly for MISC because it can be very serious. So now, more than ever, school just started in Korea. We had an uptick in new cases. So today we had a report of 40 new cases, which is the highest number of cases that we've seen in more than a month. So now more than ever, the infectious disease prevention measures of everyday life are crucial to controlling COVID-19 in Korea. So frequent hand washing, cough etiquette, covering your cough with the inside of your elbow or your sleeve, wearing a face mask, keeping 2 meters distance from strangers, avoiding the high-risk indoor spaces with poor ventilation, avoiding crowded spaces, proper ventilation, cleaning and sanitation of high-touch areas and indoor spaces. These measures, more than ever, are crucial to keeping COVID-19 under control in Korea. So friends, I hope you stay well, and I hope to see you again soon.